Borderline personality disorder is a disorder characterized by instability in relationships, personal image, and emotions. BPD usually occurs by early adulthood and has to be apparent for a year before diagnosis, which you will see in our patient.
So Margaret, your dad tells me you have been having some trouble controlling your emotions. How long has this been going on?
I don't know. About a year.
Why don't you tell me about some of the relationships in your life? Any boyfriends?
Well, I've been seeing a few boys on and off. This guy Matt and this guy Sam.
What happened with Matt?
Well, about 6 months ago, I saw him at Chick-fil-A, and he was with another girl. So I took his car, and I drove it into a church.
And what happened with Sam?
Well, he broke up with me after like a week, and that didn't really work out so well. So for the next 2 weeks, I kind of just like hung out in my room with my cat. But I made my cat stay with me so that I wouldn't feel lonely.
It sounds like you have trouble being alone.
I don't think so. I just like company.
Okay, that's enough for today. I think we've made good progress.
Part of the treatment for BPD involves being allowed to access your therapist 24/7 whenever you need to.
Ring, 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 ring.
Hello?
I just like pushed my brother down the stairs and I think he broke his nose, so my dad says I have to call you.
Hi, Margaret. Have your dad come see me tomorrow. Hi, Mr. Banks. Thank you so much for meeting with me today. I'm very concerned with your daughter's behavior. Can you try to explain how long she's been acting this way, as well as some of her behaviors?
Well, she seems very impulsive. Whenever she wants something, she wants it right away, and she doesn't think about the consequences associated with it. She only thinks in the moment. She also has an irrational fear of being left alone. It's like she's afraid I'm going to abandon her or something. Sometimes she'll get depressed for days, and she won't even come out of her room, and she'll just spend time with her cat, Owen. But the weird thing is, she really hates our cat, Dave. I mean, I can't explain it or anything. These behaviors have been going on for almost a year, it seems.
How does she view herself? Does she have a high self-esteem?
Well, it varies from day to day. Some days she's on top of the world, and other days not.
So in every area of her life, there seems to be inconsistency.
That seems to be about right.
Okay. Well, it seems like your daughter might have borderline personality disorder.
What do we do to treat this?
I can give her some medication, like antidepressants, and some anti-anxiety medication, but a lot of it will help if we do dialectical behavioral therapy, which we'll start this method of therapy tomorrow.
Okay.
Hello, Margaret. How are you today?
I'm okay, I guess.
Today I plan on starting you on a new therapy that'll help you cope with some of the problems you've been having lately. First, I just want you to lay back and relax and take a deep breath. And I want you to think positively about your life and try and push all the negative thoughts about people and things that are in your head.
Okay.
Margaret, what makes you think negatively about your life?
I don't know exactly. It's just one thing bothers me, and then everything else makes me angry or scared.
Well, Margaret, I think we've made excellent progress for today. You've officially been diagnosed with borderline personality disorder, but as long as you take your medication and continue coming to therapy, you should be able to cope with your negative thoughts and actions, as well as your reckless behavior. Do you think you can do that?
I think so.
If you start to feel this way, I want you to take a deep breath and just try and think positively about your situation. Just try and think about one positive thing. Do you think you can do that?
Okay, I guess I can try.
Okay.
Margaret is practicing dialectical behavioral therapy, which involves meditation and recognizing negative thoughts before they occur. Margaret is about to practice meditation.
Okay, now we're at that. So Margaret, how's this form of therapy been working out for you? Have you been meditating?
I've been trying to meditate like for 5 minutes every day. Sometimes I get bored when I'm doing it.
Okay, but overall it works out pretty well?
Yeah, pretty well.
And how's it been controlling your negative thoughts?
It's okay. It's kind of hard sometimes.
Yeah. Like when?
Well, yesterday someone stole my taco at Taco Bell, but I ain't even mad about it.
Because you recognized that you were about to get angry and you stopped the feelings from coming.
I guess you could say that.
Okay. How have your relationships been going?
Great! I have a new boyfriend, Joe.
Oh yeah, how's that?
Well, we've been dating for like 2 weeks, so it's kind of a big deal.
Okay. Hi, Mr. Banks. So how has Margaret's self-esteem been lately?
She's been doing great lately. I mean, she never locks herself in her room anymore. She's been a whole lot nicer to our cat named Dave. She's like a completely different person now that you've worked with her. Thank you so much.
You're so welcome.
There is no cure for BPD, but with the right mix of medication and therapy, symptoms can be greatly reduced. After 10 years, most people originally diagnosed with BPD don't even fit the criteria for diagnosis anymore. But she ignored...
Should we start? That's good, now keep going. I can cut that part out.
Okay, cut that part.
With her cat Owen. Okay. With her cat Owen, but she always ignores her other cat names.
No.
Keep going.
We can put together some bloopers.
Yeah.
Okay.
You got it.
Sometimes she gets depressed for fun. But hates our cat Dave. I mean, I can't explain it or anything. Sorry. He's so laughing.
Margaret, you can't do that.
I love it, everything. I can't help it. But I ain't even mad about it.